Yes, thanks. So, good afternoon, everyone. My name is Eli Sanders. I'm the School Health Services Specialist here at the Department of Education and work with fabulous folks here, as well as Corinna Bauer, who want to introduce yourself since it's being recorded again.
Hello, I'm Corinna Brower. I use she, her pronouns, and I am the state school nurse consultant, and I'm a host in the Public Health Division of Oregon Health Authority.
We're really excited. When Alex mentioned this opportunity to present, we got really excited as it really hits at the intersection between a lot of the work that our health service providers, our licensed health providers in our school settings provide, as well as the work that you all do, and Alex and his team, Mitch, and their team do in relationship to planning for emergencies. Um, so today, here's just a kind of an overview of what we're planning to talk about. We're going to set the stage and provide some background on just what regulations and statute and rule are in place in relationship to emergency planning, but specifically the presence of and the role of school nurses. And then we're going to move into some of the local level processes and procedures, including local incident protocols in relationship to individual students, as well as building level policies and processes, nursing services, individualized healthcare plans, and then the teams and systems. So briefly, there's two areas of OARs and statutes they tend to just go on and relate to one and point to another. But what we decided to do is really focus on two areas. One is nursing services and health services. The broader kind of statute that's behind a lot of the nursing services in our Oregon schools is ORS 336-201. And that really sets the stage in a couple big ways. One is it sets the required ratios for students who are categorized as medically complex, medically fragile, or nursing dependent. It also has strong language in there as to encourage at minimum a one nurse to every 750 enrolled students. It also in this statute, and we don't have it listed here, identifies the school nurse as the staff member or school staff member responsible for coordinating care for students within the school setting. And as we move through, just a couple clarifications on terms. RN refers to registered nurse. School nurse is an RN with an additional TSPC licensure, or sorry, certification. As RN does not need a TSPC certification to work in a school setting. And then LPN, which is a licensed practical nurse. And these nurses practice under the direct supervision and direction of an RN. Moving from statute to rule, the primary rule that covers health services in Oregon schools is 2220. And this is a Division 22 rule. So every year we hear from your districts on your self evaluation of whether you're meeting these requirements or not. But this covers a wide range, and it was recently updated in 2024 to hopefully be more clear, as well as introducing a requirement for a written prevention-oriented health services plan. So this plan is required to be developed and implemented annually. It's develop, implement, and annually update a plan for all students. It describes the health services program that the school district's providing to students, as well as a variety of required components. The first big component of this plan is communicable disease. So this fits into some of the emergency planning. Certainly, we all went through COVID together and created quite a bit of confusion. And this is where this really became, the communicable disease plan really got developed and then implemented in our school districts. What we've done here is incorporated those requirements that were part of COVID and introduced during COVID and built out some of those requirements within our health services OAR in that update. And so you'll see here And we have links as part of the slide deck, and we can share anything further after the presentation. But the plan requires the exclusion, how districts are going to exclude students who are ill. Response outlines the response to a communicable disease outbreak or event, the variety of supports that are available for impacted students. One of the things that it requires is a designated school isolation space. So this is separate from the healthcare space, separate from the office. That requirement is still has been brought on from COVID. Districts must have a communication or school communication plan that involves building all the way up to district offices. And one of the big questions I get is during COVID, districts are required to turn in their communicable disease plans. They're no longer required to turn those plans into us. They're required to have them and have them part of their systems, but they're not required to turn them in. The plans, in addition to the communicable disease part, also requires districts to outline the process to a process to assess and determine a student's health services need, including the availability of a nurse to assess student nursing needs. And this is specific to students who have a diagnosis that needs an assessment in relationship to them being able to access school. Guidelines for the management of students include services for all students, medically complex, fragile, or nursing dependent, in school, school-sponsored activities, or before and after school programming, on school-owned property, or in transit to and from school. So this really speaks to the availability of a nurse to assess the student. As this relates to emergency planning, part of that assessment and that nurse's role includes determining extra precautions, planning, supplies, medications, things that may be needed in an event that there's an emergency. Speaking of student level planning, that's prevention-oriented health services plan must also outline education and training for school personnel in relationship to health services, medication administration, any other additional health services that unlicensed staff are providing to students and the training involved. Procedures to respond, so it outlines specifically life-threatening medical conditions and then highlights allergic reactions and adrenal crisis. It highlights those two because those are two that are also supported by statute. In addition, process for the development of an individualized plan of care for every medically complex, medically fragile, nursing dependent student. So that individualized plan of care that's required is a nursing document that outlines services students need in order to attend school. Additional requirements. So these are additional requirements that aren't necessarily outlined in your prevention-oriented health services plan. However, they're still part of that Division 22 OAR and are considered required. So each school shall have a minimum of a 1:60 ratio of one staff member trained in first aid, CPR, AED for every 60 students. Emergency planning will include the presence of at least one staff member with a current first aid, CPR, AED card for every 60 students for school-sponsored events where students are present. And then lastly, each school building must have a written plan for response to medical emergencies. This plan should be articulated with general emergency plans within the general emergency plans for building and districts. So it doesn't necessarily have to be a standalone plan, but it needs to be considered as part of your overall emergency planning. I'm going to pass it on to Corinna to discuss local priorities.
All right. So this is, as Eli mentioned, this is a really exciting topic for both of us because there is so much intersection and so much opportunity. So this idea that we need individualized plans in place for our students who have identified chronic conditions or specialized healthcare needs. And at the larger level, we need these incident protocols for things like fire, flood, sort of all school events. So that's what this section I'm going to talk just briefly about some of the resources that exist for those bigger plans, a little bit about the specifics of those individualized healthcare plans and nursing services, and then kind of how those can come together, and ideally how the teams and systems are going to work to make sure that all of that planning can actually provide the supports that it's intended to. So starting with, I'm going to jump to the next slide there. Starting with our incident protocols. Next slide. We are talking about there are a lot of resources. Most of our schools have something like this in place already. This is something that's been around for a very long time. But there is this fabulous resource that Alex and Rhett and team have put together, this website that includes a number of resources for developing these and for sort of reviewing and reformatting and making these the best possible. The next slide. And again, just to reiterate, when we're talking about incidents in this section, it's the all school earthquake, fire, flood, lockdown kind of thing. A lot of us have those flip charts on the wall. And I want to reiterate, we're starting big, and we're going to be bringing in the idea of medical emergency as part of all school event planning as well as individualized planning. So this website includes national guidance. This one example that's on that slide, talking about just in general for any one of these types of emergencies, we're wanting to touch on these 5 different areas: prevention, protection, mitigation, response, and recovery. And it sets up a number of other guidelines just for the general development of an emergency plan. Next slide. The website has resources for risk assessment. So thinking about different types of potential emergency, and in your area, in your school's setting, how far away are emergency services? What are some of the specific risks and potential challenges related to the different types of potential emergencies? So helpful tool to be looking through in terms of part of planning. There are also resources talking about incident command systems for school. Our next slide, actually. And this will actually get into in a little bit more detail, just thinking about who is responsible for what, and really kind of outlining, if there is an event, what button do we push, or what extension do we call to get things started, to make sure that the people who know the most what to do are notified and activated as quickly as possible. And the next slide, there's a I think slightly more in-depth resource talking about community collaboration. So you have your incident command, or whatever the local name for that is, your rapid response teams, and then you have this larger understanding of all the collaborators that are involved in any sort of event. So our internal partners like teachers, nurses, front office staff, all the different players within the schools, our emergency responders, other community partners, things like local community centers or places where people might gather after, after earthquake evacuation or that sort of thing. So lots of excellent guidance and resources on that website, and more again on that collaborative aspect of this work in just a moment. So the second thing that we're really focusing on or wanting to highlight is the idea that school nursing services and individualized healthcare plans have a big part to play in emergency planning as well. And we have, again, today we're staying pretty high level. So we have a lot of resources that can help the registered nurse, school nurse, develop plans for students with all the different types of health conditions that we see. There's also resources for the nurse themselves to develop additional skills and have that support they need to be the best possible resource for their students. And the next slide, there's the state examples, there are national examples as well, lots of resources for helping develop these individualized plans for students who have a known condition. And this is just one example. I said we're not getting too much into the details today, but thinking about, for any health condition, there are many health conditions for which there's a potential risk of individual emergency. Asthma is one example for which we have a lot of standardized templates and ways of setting up an emergency action plan. But the same could be said for a student with seizure, a student with type 1 diabetes, a student with pretty much any health condition that has the potential to have a significant event or potentially be life-threatening. So thinking as part of that planning, as part of the individualized care plan development, having an emergency action plan or emergency care plan set up is part of what that school nurse is doing. And potentially our community partners as well, our healthcare professionals and specialists working with that student. So knowing that there's likely going to be an emergency action plan or emergency care plan if there's a student that has a potentially life-threatening condition. And on our next slide here, there are some local districts that have developed, knowing that certain conditions have certain things in common. We always want to develop individualized plans, make sure that we understand the student's specific signs and symptoms and that sort of thing. But also having, for example, one district that I'm working with is thinking if there's a substitute in the classroom, if there's someone who doesn't necessarily know the students as well, can we have a kid collapses in front of you, what do you do kind of list? And there are a number of districts that have that sort of thing available where it's, if you see this, step 1, do this, step 2, do that, and have made that kind of a generalized resource. And then once you've gotten through the immediate response, you're pulling in the people that have the student specific training and know how to work with that individual student's specific plan. And the next slide is the bringing it together. This is another resource from the Alex and Rhett website that we were talking about. If we have a student who has a health condition that may impact their ability, for example, to evacuate, whether it's intellectual developmental disability, whether it's using the wheelchair or other mobility device, whatever it is, a student who has significant anxiety that may trigger an asthma exacerbation, whatever it is, knowing our students well enough so that as we're thinking about our large scale planning, fire, flood, etc., evacuation planning, or other lockdown drills, whatever it is, having individual plans in place to ensure that each and every student is going to be safe throughout those events, and that their individualized needs have been identified and planned for and prepared for ahead of time. And this ideally, what we're doing is bridging the gap between these two resources. We've got a lot of resources that are nurse specific. We've got a lot of resources that are sort of big picture event specific. So having this idea that we're working together as a team, knowing what our students' individual risks are, and as part of that individualized healthcare plan development, that includes, and if there's a such and such event, here's who's trained to help that student with their mobility device or whatever it is. And as we're thinking about evacuation protocols, we're also thinking, and for our students who have such and such individualized needs, here's the way that we're going to train staff and make sure everyone knows how to provide those supports. And there we are shifting from those. That was our very quick overview of the types of topics that we're hoping to really get in depth with, thinking about emergency response and emergency planning. I'm going to touch briefly on roles and responsibilities from the school nurse side and then hand it back over to Eli to kind of bring us all together. So one of the things we found, a big part of my work is direct with individual nurses, but another large portion of my work is working with school health teams. So the whole collaborative entity that's trying to work together. And I think the biggest piece of all this is you can have the best trained individual in the world, the best trained nurse in the world. They're not going to be effective in supporting our students if we don't have that, the notification and communication protocols in place, if we don't have that team really built with understanding who's who's best able to support different things and who is responsible for supporting different things. So clarifying roles becomes a really important part of emergency planning. And what's on the screen there is an example that one district developed of when the nurses want to be notified if there are issues going on. And next role, if you click twice, there's a little transition here. There are, the Oregon Health Authority has provided some additional information and resources that helps to clarify some of school nurse role and some of the types of work that school nurses do as well. So again, just thinking in terms of what is the potential if we have a single nurse who's serving 6 schools, we're going to have a different level of integration than if we have a nurse who's serving full-time at a single school. But just knowing there are places where the team is set up such that you have a healthcare professional who's able to provide not only the individualized planning for a student, but also contribute to that bigger picture, thinking about communicable disease mitigation and what that means for our individual students who might have challenges, higher risks and that sort of thing. For the nurse to be part of the planning for evacuation when there are students that have specialized needs or things that might impact them individually. So again, just going back to having roles, responsibilities, and collaborative partnerships really strengthened can be a hugely important part of emergency planning in our schools. I'm gonna hand that back over to, there it goes.
I was late on your animation.
That's all right.
To kind of tie it all back, as this relates to in my world at ODE and working with school districts to implement health service programs in their schools, is that school districts, and the intention was when this was put in that the prevention oriented health services plan would be the opportunity to kind of pull everything together, all the health requirements into one document, where a team or multiple people can really work to identify ahead of time before an emergency or before a student shows up with type 1 diabetes, and there's not someone to provide, or a school nurse to provide an assessment and develop a plan for before these things happen, that something's in place. And so kind of piggybacking on whose role different parts of this plan falls on, the ODE we've developed multiple types of resources on the links here included on this slide on our health services website that really walks through the school district's team in helping them identify and walk through each requirement of the OAR. And part of those requirements are, for example, the integration into the other emergency planning. The idea being that when something does occur, that there's identified people who are familiar with the plan, that there's protocols and processes in place to implement whatever needs to be implemented, depending on if it's a student, allergies, who needs a quick access to an administered epinephrine, or something more school-wide type of emergency. And these plans, this OAR was adopted in 2024. So school districts first reported on their plans this last November. And here's just an example of, again, a resource that is still in the works, being developed with the school district in relationship to really identifying key roles within that student's experience, or the students in general, their experience in school. So you'll see students, parents, guardians, and caregivers are key partners to all of this, especially when in a relationship to student specific medical conditions, or needs for their specific needs for services from licensed medical professionals. Right below that, you have the school nurse. We've talked significantly about school nurses. There's also OTs, PTs, SLPs. More and more, we have uh, our licensed mental health staff who are responding and are really important members of teams and direct support for students who are trying to manage a mental health crisis. For example, our building administrators, we can't forget you all, as they are really they're really key in making sure not only that plans get developed where these conversations are happening, but that they're being revisited, and that students are receiving the access and the services that are determined necessary. We also have uh, all every school employee, and maybe even extending that to volunteers and other adults in the building have responsibilities in relationship to an emergency situation, and specifically related to calling 911, but also, for example, with the recent legislation around naloxone, there may be school staff or other adults in the building responding to an emergency. And so accounting for what their role is in case of an opioid overdose, administering naloxone, that may be a role either provided for explicitly in a plan or just happens to be a volunteer or someone nearby the school who responds. But accounting for those types of individuals as well. And teachers and staff. And speaking of the choir, teachers know their students oftentimes more than anyone else, and also interact with the family, and so are key partners in relationship to the health needs of their students. They are also key partners in relationship to identifying changes in medical or health conditions, or additional needs for services. We have designated trained staff. There's certain medical conditions that certain conditions or services that may be delegated, for example, as determined by the nurse themselves. That may require additional training and supervision in relationship to that formal delegation. In addition, we have medication administration that any school employee can be trained and be designated to administer medication. All those things need to be tracked, and to ensure that there's someone available on the field trip to administer the medication that's needed to be provided in a case of emergency, for example. Also, how are we communicating with EMTs? All right, let me back up. How are we accounting for the arrival and intervention from our emergency responders? Who are they connecting with when they come to school? What information are we able to provide right off the bat? How are we connecting and developing a partnership with these key folk? And then community providers. There's a lot of, depending on the community, there's a wide variety of community partners that are within our schools. I'm again thinking of some of our mental health partners who are providing a lot of services to our students, but many schools have access to a school-based health center, or other community type medical service, and what type of integration or how are we communicating, and what can we communicate to those partners to better keep our kids safe. So the key thing is not that there's a kind of a rubber stamp for what each person does, but it's what do they do in your community, in your school district, in an event of an emergency. And Alex, I think that's it for our slides. Happy to take questions, concerns, comments, jokes.